So this Insta lecture will be on meningiomas, the CNS tumors. But before that, I'd like to give you a brief overview about the CNS tumors. When you think about CNS tumors, always first rule out the metastases and secondaries, because a large chunk of CNS tumors are metastases. And when you think about metastases or secondaries in the brain, think about 5 possible sources. First one is lung cancers are very much commonly they metastasize to brain, particularly the small cell lung carcinoma, and also in lung cancer in general. Then think about breast carcinoma. Then think about skin cancers, particularly the melanoma. Think about kidney, renal cell carcinoma, and also think about the GIT cancers. So 80% of the secondary or metastatic cancers in the brain, they originate from these 5 sources. That is lung, breast, skin, kidney, and the GIT, gastrointestinal tract. And if you look at the secondaries and the metastases, they have certain characteristics. Mostly the metastatic tumors in the brain, they are located at the junction of the gray matter and white matter. And they are sharply demarcated. They often have multiple masses, and they usually are separated. They usually have an edematous zone actually surrounding the tumors. So these are, and particularly the most important thing is that they will be located at the junction of the gray matter and the white matter area. Now, apart from the secondaries, the next thing you need to read about are the primary tumors. And primary tumors, I am going to do an extensive discussion on the primary CNS tumor, and the first one, this one, would be on meningioma. Now, meningioma, from the name you can guess that they are somehow originating from some cells which are related to the meninges, and you are correct. They are mostly a dura-based mass, but they not exactly arise from the dura, but they arise from a membrane attached to the dura, that is arachnoid. So meningothelial cells of the arachnoid membrane, that is the source and origin, usual origin for the meningiomas. Next key concept of meningioma, that they are a brain tumor in adults. Some brain tumors are actually seen in children, like medulloblastoma, pilocytic astrocytoma, ependymoma, atypical teratoid rhabdoid tumor. But unlike those pediatric or childhood brain tumors, this CNS tumor, meningioma, is seen in adults. And the next key concept is that they are more common in the females. If they are originating in the usual brain, then the ratio is usually female to male ratio is 2:1 to 3:1, and if they are originating in the spinal cord, then the ratio is much more tilted in the favor of the females. The ratio would be in the range of 9:1 to 10:1. That means if there is a spinal cord meningioma, then 90% of them, mostly those spinal cord meningioma, will be seen in the females compared to roughly 10% in the males. So that is a key concept that you need to keep in mind. And why they are more common in the females? The idea is this, that they are somehow related with the female hormones, particularly the estrogen and progesterone receptors have been seen in this meningioma. Meningioma, sometimes they rapidly increase in size during pregnancy because they have these female hormone receptors over there. Coming to the risk factors for the meningioma, the most important acquired risk factor is the history of exposure to the ionizing radiation, and that has been found long back, particularly in the last century, 1950s and 60s. There are a lot of people, they would get exposed to low dose radiation for the treatment of tinea capitis, and they used to get radiation as a treatment, and many of them, they develop meningioma later phase. And particularly the atomic bomb explosion those who were exposed to them, particularly in Japan in 1945, 6th and 9th August, Hiroshima and Nagasaki bomb explosion, or those in the old USSR, that is in Chernobyl, Ukraine incident. So those people who have been exposed to some kind of atomic bomb explosion, which are uncommon events, they have also been found to have increased incidence of having meningioma. So by any chance, if you have been exposed to you have an increased exposure to the radiation in the earlier phase of your life, you are more prone to develop meningioma. So the most important acquired risk factor for the development of meningioma is your previous exposure to radiation. And another key genetic factor or hereditary factor which is associated with this is if you are neurofibromatosis type 2. Neurofibromatosis type 2 patients have been seen who harbor a mutation on the NF2 gene on the chromosome 22. And the patients of neurofibromatosis type 2, they are seen to have multiple meningiomas. They're prone to have multiple meningiomas. And neurofibromatosis type 2 patients also have some other tumors, like they can have bilateral schwannoma, bilateral acoustic neuromas. They can have spinal cord ependymomas, and also along with that, they can have multiple meningiomas. So, and many of the meningiomas are sporadic too, and those sporadic ones, they also have some abnormality on the chromosome 22. So meningioma many times are associated with some defect in the chromosome number 22. You need to remember this, particularly the association of the NF2 gene. So when you're thinking about the risk factors for the meningioma, ask about is there any previous exposure to the radiation, ionizing radiation in the head and neck region particularly, and also rule out the possibility of the neurofibromatosis type 2. And another one, though less common than neurofibromatosis type 2, main type 1, multiple endocrine neoplasia syndrome type 1, that has also been seen in some association with meningioma. But less commonly compared to NF2. So two syndromes, NF type 2 and MEN 1, have been found to have some association with the meningiomas. Now meningiomas, if you the presentation, they can present with some vague non-localizing symptoms. Many times they are discovered accidentally. A CAT scan was done for some other purposes in a middle-aged female, or they're complaining of some kind of headache, and they show some dura-based mass with a dural tail, which is compressing the underlying brain. And this tumor usually do not infiltrate the brain, but compress the underlying brain. That's the idea. And World Health Organization, they usually categorize meningiomas into WHO grade 1. Most of them are WHO grade 1 benign. Some of them are grade 2, and some of them are grade 3. Grade 3 are considered as a kind of malignant variant of meningioma, but they are less common. And histologically, they have a lot of variance, but some of the key points which are worth mentioning, I feel that they show some holding pattern. They show samoma bodies, particularly the somatus varians, which is thought to be a form of dystrophic calcification. And it's not exclusive for meningioma, it's seen in many other tumors like ovarian serous adenocarcinoma can show it, papillary carcinothyroid can show it. So there are many tumors associated with many samoma bodies. Meningioma is just one of them. These will be the features. And meningioma is usually present with some kind of firm globular mass attached to the dura, which is compressing the underlying brain. And sometimes they can have a plaque-like appearance also. They're called end-plaque meningioma. So in a nutshell about the meningioma, the key points that you need to know, that usually they're benign, slow-growing tumors, primary tumors, which arises from the meningothelial cells of the arachonoid membrane. The risk factors are previous exposure to the radiation, ionizing radiation, and association with neurofibromatosis type 2. And also, though less commonly than neurofibromatosis type 2, is association with MEN type 1. Biopsy, they can show a holding pattern, they can show, and samoma body. And one variant of meningioma that is called secretory meningioma, they can show pseudosamoma bodies. That is also worth remembering for all of you. So meningiomas can show samoma bodies, and secretory variant of meningioma can show pseudosamoma bodies. And the presentation is usually with a middle-aged or elderly female with some non-vague localizing symptoms or accidentally detected during the MRI or the radiography. So these are the key points about the meningioma in a nutshell. The other CNS tumors I will be discussing in this coming series. Thank you very much.